Hey there, Christophe from the French Herbal. In this episode, I will not be talking about herbs directly, but overall health. A few months ago, I sat down with Dr. Jean-Loup Mouysset, a French oncologist who spent the last 30 years asking a question that most doctors won't. What if we could double cancer survival rate by changing just one thing? Not a new drug, not a miracle supplement, but what patients do while they're going through their treatment. The results, a 50% improvement in breast cancer survival rates, patients living years longer with better quality of life, and yet this is happening outside hospitals, largely ignored by mainstream oncology. In this episode, I would like to explain what he discovered, why it works, and how it changes everything about the way we think about cancer treatment. The interview was very popular on my French channel, and I wanted to share this with you. Mouysset is the author of this outstanding book on integrative oncology. I don't think it's been translated, unfortunately, and all scientific and medical references to back up his claims are in the book. Please note that I'm not a doctor, a pharmacist, or a licensed healthcare professional. Dr. Mouysset is an oncologist who prescribes conventional treatments like chemotherapy, radiotherapy, immunotherapy. The goal of our discussion was to show what can be done as a complement to conventional treatment, not as a replacement. And always check with your oncologist if you're considering complementary approaches, as interactions may exist. Okay, so let's get started. Every single day in France, 1,300 people learn that they have cancer. That's 1,300 new diagnoses every single day. Conventional oncology has made real progress, chemotherapy, radiotherapy, and now targeted immune therapies. They save lives, and Dr. Mouysset is very firm on that point. But here is what he will tell you. Chemotherapy alone isn't enough. It treats the cancer cells, but it does not address the person who's carrying it. And he realized this 30 years ago when he was training as an intern. He was watching patients go through brutal chemotherapy, losing their hair, suffering from nausea, depression, and anxiety. And he thought, there's got to be a better way. Then in 1995, something changed. He got a scholarship to spend 6 months at Stanford University, studying under David Spiegel, one of the world's leading psycho-oncologists. Spiegel has done something radical. He took cancer patients, he put them in support group and taught them stress management alongside their chemotherapy. And then he measured the results. The patients who followed this integrated approach didn't just feel better, but they survived longer, significantly longer. This is the moment Mouysset realized we've been treating cancer wrong, not because chemotherapy is bad, but because we're ignoring half of the equation. Let's talk about what integrative oncology actually produces. For breast cancer, standard chemotherapy brings 70% survival rate. If you add an integrative approach, you bump that up to 85%. That's a gain of 15 points. Not a small bump, it's a major shift. Mouysset's program took patients with metastatic cancers, those that have spread beyond the primary site, and at least double their survival rate. We're talking about patients who were given 18 months to live, and they lived like 5, 6, or sometimes 10 years. One patient, Jocelyne, she lived 10 years with metastatic pancreatic cancer. And she didn't just survive, she became the director of daycare at the center Mouysset manages. Another patient, Nicolas, had metastatic kidney cancer that spread to his brain and lungs. His doctor said there was nothing left to do. And 15 years later, he's still there. No more treatment. He's in remission. And these aren't one-off miracles. This is a pattern that Mouysset has documented across thousands of patients over 25 years. And the results were published in peer-reviewed scientific journals with David Spiegel. This isn't alternative medicine rhetoric. This is evidence. I will put a link to the full article on my website. So the question becomes, if we know this works, why isn't everyone doing it? And the answer is uncomfortable, but Mouysset doesn't shy away from it. When you tell a cancer patient, come join a support group, you'll meet 10 other people with cancer, you'll participate in the group's activities, and you will process your experience together, 95% of them say, nope, thank you. I don't want to be trapped in my illness. And there are two things happening here. First, the isolation instinct. Cancer is isolating by nature. Your biological reflex is to retreat, to protect yourself, to pull inward. It's normal. It's survival. And Mouysset uses the image of the cancer as a crab, as a predator hunting isolated prey. Second, change is terrifying. When you get a cancer diagnosis, you're in shock. You want stability. You want someone to fix it for you. And the idea of becoming active in your own recovery, of confronting your fears, of changing your diet and stress patterns, and of changing your social network, well, that feels like too much. So most patients do nothing. They show up for chemo, they wait passively, and the medical system accepts this because, well, it's easier. The conventional system is overwhelmed today. And here's another thing that Mouysset discovered. The location of those activities matters. You cannot do this in a hospital. The hospital reminds people of sickness. You need a place that says, this is about becoming stronger. We're among friends here. This is why in 2001, when the hospital where he was working refused to support his integrative vision, he founded a place called a Resource, a center designed not to treat the disease, but to make people more resilient, more resourceful, and more capable of not just surviving, but more importantly, of thriving. A quick pause to let you know that you can grab my free ebook on preparing herbal teas for the 4 seasons. It's full of simple recipes and blends you can make with herbs you can buy or even grow almost anywhere. The link is right below this episode. I hope you enjoy it. So what does integrative oncology actually looks like? What are patients doing differently? Mouysset calls the whole process the PACTE Framework. And let me break it down for you. Every letter of PACTE, so P-A-C-T-E, stands for a French word, so it doesn't work in English, but it doesn't matter. Here are the key points. Stress management is number 1 because stress directly damages treatment outcome. If you're on immunotherapy for lung cancer, for instance, and you're in chronic stress, your treatment efficacy drops by 30 to 50%. Mouysset confirmed this through published studies. And immunotherapy involves very expensive drugs. We're talking about thousands of euros or dollars every 3 weeks. And stress cuts their effectiveness in half. Can you imagine? So the question isn't, should I manage my stress? But it's rather, why am I not managing my stress when the cost of not doing so is that severe? For stress management, Mouysset uses several tools: heart rate variability training, sophrology, which is a kind of relaxation practice, adaptogenic herbs like rhodiola. The actual method isn't what matters here. What matters is finding something that calms you. Then do it consistently. It could be relaxation, meditation, doesn't matter. Do it day in, day out. Then there is nutrition. And this is a whole subject that I will not cover here. There's a lot of common sense advice like eating whole food, eating organic food. And here is where one conventional piece of advice gets flipped. In natural health circles, we obsess about cutting sugar, and that's right, most of the time. But during chemotherapy, the science says something different. Chemotherapy only kills cells that are actively dividing. Cancer cells divide fast. So you actually want them active, coming out of dormancy, proliferating, because that's when chemo can kill them most effectively. And sugar feeds rapid cell division. So during chemotherapy, if a patient can only tolerate sugar, Mouysset says, let them have it. This isn't permanent, but for those weeks of treatment, it serves a purpose. Beyond that, the data is pretty clear. Patients who eat mostly whole foods, meaning minimally processed food, have 58% less mortality than those eating heavily processed foods. Patients eating organic foods have 25% fewer relapses. Vitamin D plus a quality multivitamin supplementation reduces breast cancer relapse by 25%. So sure, some people may say these are incremental gains, but they compound and they are in the patient's control. So nutrition and the right supplements are very important. Then there is physical activity. Walking during chemotherapy improves outcomes and tolerance. That's it. Simple. Just walking. And yet, many patients are told to rest to preserve energy. But Mouysset's data shows that gentle, consistent movement, even 20 to 30 minutes of walking a day, improves both quality of life and prognosis. And then there are social connections. This is deeper than just having friends. It's about building a circle of people you can be completely honest with. People you can tell, hey, I'm scared I might die, without them shutting you down or offering false reassurance, which is what family will do most of the time. And they do it out of their heart, of course, but they will say things like, oh, nonsense, please don't say that. Of course you won't die. But we need to express those scary feelings without being corrected. It's about identifying the people in your inner circle who can act as emotional shield. Someone who can sit with you at doctor's appointment and ask the right questions. Someone who can interrupt the doctor when he's talking over the conversation or when she or he is not showing enough consideration. Someone who can help you manage your daily life as well, your kids, your meals, etc. Lonely patients have worse outcomes than connected patients. This is consistent across all cancer types. The social network is very important. Then there are complementary therapies. And this is where plants, herbs, supplements, and other modalities come in. But here's the key. They're not replacements, they're optimizers, right? Melatonin is a perfect example. Your body makes it naturally. At 0.5 milligram, it boosts immune function. At 10 milligram, it has oncolytic effect, meaning that it slows cancer growth. At 20 milligram, it acts as an antioxidant. So the dose determines the function. And Mouysset says the benefits of melatonin on quality of life are immediate. Better sleep, less anxiety, less pain. And the data suggests it improves treatment efficacy. Same with plants. Curcuma, green tea, boswellia, they're not magic bullets, but they reduce inflammation, they support immunity, and they improve how a patient experiences their treatment. So let me repeat the 5 key aspects of the PACTE framework: stress management, nutrition, physical activity, social network, not an app. We're talking about real in-person human connections here, and complementary therapies. And honestly, even if you don't have cancer, this framework applies, of course, to all and any condition. These are the foundations of health and prevention. They're how you build resilience before you need it. Now, here's the thing that separates Mouysset's approach from alternative medicine thinking. He doesn't pit conventional and natural against each other. This is not alternative, this is complementary. He says that chemotherapy is like a master archer. It's precise. It kills dividing cells, but it cannot do everything. It's not meant to do everything. The complementary work, the stress management, the nutrition, the movement, the plants, they're not fighting chemotherapy, right? They're creating the conditions for chemotherapy to work better. And here's the deepest insight from this interview, and I think it's the one that matters most. When you get a cancer diagnosis, it's like a trauma. Your first instinct is to find a savior, a doctor, a drug, something outside yourself that will fix the situation. And the medical system reinforces this. You go to appointments and doctors make decisions for you. You comply. Mouysset says it's like a child-parent relationship. And that structure can actually worsen outcomes because it deepens the sense of powerlessness. Mouysset's entire model is built on flipping this. You're not a patient waiting to be saved. You're the master of your own health. The doctor is a player in your team. Chemotherapy is a player in your team. Plans too. Support group too. And you orchestrate the team. But you are the architect. And the moment a patient shifts from what will the doctor do for me to what can I do for myself, that's when everything changes. And Mouysset is not making that up. He has observed it for 30 years. Patients who take agency, who feel they have control, who actively participate in their recovery, they do measurably better. This is why the center he built is not a hospital. It's a campus. It's a place designed to say, you have resources, you have capabilities, come learn to access them. The work begins the moment you recognize, I have more power than I thought. Mouysset is now 25 years into running this center. He has trained other centers across France. He has published research with world-leading scientists, and he wrote a 600-page book documenting everything, the science, the philosophy, the case studies. And he also wants to educate children, teaching young people that health isn't something that happens to you, it's something you build through how you eat, how you move, how you manage stress, how you show up in relationships. He talked about health camps for kids, about cooking classes for kids, growing medicinal plants, making herbal remedies. If we wait until someone is diagnosed with cancer to teach them these skills, we're starting late. But if we build a culture where this is normal, where integration is the default, where people understand their own resourcefulness, then we prevent a lot of suffering upstream. Okay, that's it for today. Thanks for listening. I will talk to you soon for the next episode of The French Herbal.